Yeah, everyone, good afternoon. Sorry, I have closed actually from duty, but I just saw this case now and I can't just allow it to go like that. I just saw a case of anencephaly on a scan now, okay? Anencephaly means that a baby, okay, a woman that is pregnant came to do scan and some part of the brain and skull are missing, okay? It is called anencephaly. Okay, it is a congenital anomaly. That is why it's advised in pregnancy. It's advised for you to do at least 3 scans in pregnancy. One in the first trimester to get the correct dating of the pregnancy. The second one is around 22 weeks to find out if there is any structural anomaly, whether the hands are complete, the legs, the head, everything is complete. Okay, so that is exactly what this woman did, and this is my first time of seeing it since medical school. I've been reading the books, textbooks, I'm hearing anencephaly, and now I've seen it live. Okay, so that is why I'm making this video. So the third scan is usually the third trimester, just to check that the baby is fine. Okay, so the woman did scan and it happened that it's an encephaly, some part of the brain and skull are missing. Okay, of course, it has been confirmed in a second opinion scan from a different center, and we have even sent for the third one. It's a serious something, and it has a far-reaching implication. So we must be completely sure that it is really an encephaly before we go ahead. Okay, so let us briefly talk about it. What is an encephaly? I've already defined it. It is a baby in the womb. Okay, it's a baby that has some part of the brain or skull missing or both. Okay, all right, usually seen in second trimester scan. Okay, how common is it? Okay, from what I checked, about 1 in every 4,600 births in the United States. That's about 0.2%. Okay, in Africa it's about 0.14%. In Nigeria it's about 0.13%. Okay, the commonest country in Africa is Ethiopia, Eritrea, and which other one? And Algeria, from what I found from studies. Okay, Ethiopia, Algeria, and Eritrea are the commonest countries with this high prevalence of this. Of course, Nigeria is almost the same rate, 0.13%, based on the studies that I checked. All right. So I know you're asking, so doctor, what is the solution? Or first of all, what is the cause, right? Of course, there is no known cause. It's just like a car moving from a plane moving from one country to the other, and then there's a plane crash. You ask, what is the cause? Of course, there should be a cause, maybe, but there are so many things to think of. All right. It could be a genetic abnormality, could be a mutation, it could be could be anything. But the most important thing that there's a deformity there. Okay. And what is the solution? Okay. First of all, prevention. Prevention is all women. Of course, this is where the reason why I'm actually making this video. Okay, so that they say let the living praise the Lord, right? So that all women of reproductive age are advised to take folic acid. Okay, it helps to prevent this kind of abnormalities. Folic acid every day. Okay, not just when you are pregnant, but if you are a woman of reproductive age and you are possibly living with a man and there's a likelihood of pregnancy, start taking folic acid 400 micrograms daily. Okay, especially for the first 3 months. The reason why women of reproductive age are asked to take it is because before so many of you find out that you are pregnant, you have already passed the first 3 months, which is when it is actually needed. So instead of you to risk it to when you are pregnant, as long as you're a woman of reproductive age living with a man and doing what could possibly lead to pregnancy, then you are advised to take folic acid to help to prevent anencephaly. I think this is actually the real essence of making this video. If this is the only part that you understand, then we are home and dry. Okay, doctor, that is prevention, right? Now that it has occurred, what do we do? Well, the survival is almost 0%. There's almost zero chance of survival. Okay, so those of you that are asking the medical indications for termination of pregnancy. This could be one of them. Okay, the pregnancy won't survive, and there is no need allowing a woman to deliver a baby she won't even be proud to look at. Okay. Of course, there are so many. The whole thing has to do with the family, the parents and the husband, the woman and the husband coming together to understand the reality of the case and then going with the doctor's prescription, which is most likely for the pregnancy to be, terminated. Okay. I think that is it. All right. So in this case, in our own case, I've asked the woman to go for the third scan. Okay. Let us have a third. We might even have a fourth opinion scan, so that if all of us are on the same page, then obviously we are on the same page. But certainly it is actually what it is. Okay. So take folic acid if you are in a reproductive stage. All right. If you have a question, please do ask. The comment box, I'm open to all your replies. Thank you for watching me.